Please get ready for a dictation from Hindustan Times dated 22nd May. The news item is titled Framing an Agenda for the Opposition. 5 seconds. Start. Already battling the coronavirus disease, West Bengal has been battered by cyclone Amphan, while preparatory arrangements and evacuations of 5 lakh people by the state government ensured that the loss of life was minimized. The devastation suffered by families and the damage to public and private properties as well as the ecology of Bengal has been incalculable. The cyclone is a national calamity. In this hour of pain and tragedy, Bengal seeks everyone's cooperation. All stakeholders, state and central, have to come together to provide relief and solace to those who are suffering. It is against this backdrop that opposition parties meet on Friday for the first time since COVID-19 hit India. There is much to discuss. Many states are run by parties that are in opposition at the center. They will share experiences. They will also compare notes on the center's response and on the gap between its words and deeds. The political impact of the COVID-19 response and the spirit of federalism will inevitably come up. It is important to note that all opposition parties were not always on the same page. In early March, the Trinamool Congress and a few others were aggressive in urging adjournment of Parliament and taking coordinated steps. The National Democratic Alliance government would not listen. Some opposition parties decided to trust its judgment. Meanwhile, in West Bengal, Chief Minister Mamata Banerjee began preparing regardless of New Delhi's views. When the 21-day national lockdown was announced, at just 4 hours' notice and without consultation, the opposition parties and their state governments continued to be supportive. They abided by Prime Minister Narendra Modi's request to eschew politics in this hour. It is another matter that the Bharatiya Janata Party sought to politicize the response to COVID-19 in the states, with the bulk of the party-sanctioned online derival being reserved for Bengal. The BJP and the centre have showboated their efforts. They have grabbed publicity but left the states to handle the crisis. I will illustrate with 2 sets of examples: testing and cost of treatment and the so-called economic stimulus announced last week. On April 22, the West Bengal government was the first to announce free treatment for COVID-19 patients in private hospitals requisitioned by the state. The government undertook the cost. On April 30, the Maharashtra government imposed a price cap on COVID-19 treatment by private hospitals. It took a leaf out of West Bengal's book and extended free treatment to all residents of the state under the State Health Insurance Scheme. This is how states learnt from each other. What did the center do? It confused everybody on the testing protocol and was at sixes and sevens when it came to providing overarching guidance to states both before and after March 24. Testing labs could be cleared for COVID-19 only by the Indian Council of Medical Research. The Union Health Ministry and the ICMR took their time. In states where 20 laboratories were required and available, only 2 were cleared. Once the clearances came, the states got to work. Laboratories have been working in double and triple shifts to ramp up testing. Bengal is testing close to 9,000 samples a day, among the highest in India. If we could not test so many earlier, it was because the clearances and kits from the center did not arrive. That is not an excuse, it is a fact. Governments from Bengal to Chhattisgarh and Kerala to Punjab have complained of such over-centralization, while many states have gradually increased their testing numbers over 2 months. I must point to the curious case of Gujarat. It showed a jump from 3,000 to 10,000 tests in a single day. Is there something more than meets the eye? Stop.